Since November 2019, most of the news are talking about a new virus, COVID-19. Meanwhile, every country started posting daily updates regarding the number of new cases and new deaths. The numbers started jumping, and WHO declared that the virus has turned pandemic. Since then, scientists all over the world have been working day and night to come up with a vaccine that can return to us our normal life. In this video, we will talk about what is a vaccine, how do vaccines work, how are vaccines developed, recent vaccine updates. Watch till the end of this video to know if you are currently eligible to take the vaccine. What is a vaccine? Vaccines save millions of lives each year. Vaccines work by training and preparing the body's natural defenses, the immune system, to recognize and fight off the viruses and bacteria they target. If the body is exposed to those disease-causing germs later, the body is immediately ready to destroy them, preventing illness. How do vaccines work? Germs are all around us, both in our environment and in our bodies. When a person is susceptible and they encounter a harmful organism, it can lead to disease and death. The body has many ways of defending itself against pathogens, disease-causing organisms. Skin, mucus, and cilia, microscopic hairs that move debris away from the lungs, all work as physical barriers to prevent pathogens from entering the body in the first place. When a pathogen does infect the body, our body's defenses, called the immune system, are triggered and the pathogen is attacked and destroyed or overcome. The body's natural response. A pathogen is a bacterium, virus, parasite, or fungus that can cause disease within the body. Each pathogen is made up of several subparts, usually unique to that specific pathogen and the disease it causes. The subpart of a pathogen that causes the formation of antibodies is called an antigen. The antibodies produced in response to the pathogen's antigen are an important part of the immune system. You can consider antibodies as the soldiers in your body's defense system. Each antibody, or soldier, in our system is trained to recognize one specific antigen. We have thousands of different antibodies in our bodies. When the human body is exposed to an antigen for the first time, it takes time for the immune system to respond and produce antibodies specific to that antigen. In the meantime, the person is susceptible to becoming ill. Once the antigen-specific antibodies are produced, they work with the rest of the immune system to destroy the pathogen and stop the disease. Antibodies to one pathogen generally don't protect against another pathogen except when two pathogens are very similar to each other, like cousins. Once the body produces antibodies in its primary response to an antigen, it also creates antibody-producing memory cells, which remain alive even after the pathogen is defeated by the antibodies. If the body is exposed to the same pathogen more than once, the antibody response is much faster and more effective than the first time around because the memory cells are at the ready to pump out antibodies against that antigen. This means that if the person is exposed to the dangerous pathogen in the future, their immune system will be able to respond immediately, protecting against disease. Recent vaccine updates. There are currently more than 50 COVID-19 vaccine candidates in trials. WHO is working in collaboration with scientists, business, and global health organizations through the ACT Accelerator to speed up the pandemic response. Novavax vaccine shows 89.3% efficacy. Novavax have announced that, according to an interim analysis of Phase 3 clinical trials, their vaccine candidate demonstrates 89.3% efficacy. The analysis included 62 cases of COVID-19, 56 of which occurred in the placebo group, and 6 in the vaccine group. The study involved more than 15,000 participants, 27% of whom were 65 or older. The United Kingdom, where the trials took place, has already purchased 60 million doses. Pfizer vaccine efficacy was 52% after first dose and 95% after second dose. The results of a recent study, which appear in JAMA, conclude that allergic reactions to the Pfizer vaccine are rare. For every million first doses, the researchers estimate a rate of 11.1 cases of anaphylaxis, which is a life-threatening allergic reaction. Johnson & Johnson vaccine candidate 66% effective. According to an interim analysis, which included data from 43,783 people, the Johnson & Johnson single-shot vaccine is 66% effective in preventing moderate or severe COVID-19 from 28 days after vaccination. Overall, the experimental vaccine was 85% effective in preventing severe disease. The priority list for the COVID vaccines and how you will be contacted. States will receive these first doses based on their population, and governors will then determine how to distribute the vaccine. But healthcare personnel and long-term care facility residents should receive the vaccine first, according to the Advisory Committee on Immunization Practices, the independent panel of medical and public health experts that's responsible for coordinating vaccine distribution. Healthcare personnel includes all paid and unpaid people who work in healthcare settings and are at greater risk of exposure to COVID-19 patients or infected substances, according to the CDC. This group includes everyone from physicians to medical students, maintenance staff in hospitals to home aides and more. People who live in long-term care facilities, such as nursing homes and assisted living facilities, are priority because older adults are at a greater risk of requiring hospitalization or dying from COVID-19. Between now and the end of December, you would likely get a substantial proportion of healthcare providers and people in your nursing homes vaccinated, Dr. Anthony Fauci told New York Governor Andrew Cuomo on December 8. The vaccines are distributed to hospitals and long-term care facilities, where CVS and Walgreens will administer the vaccinations to residents and staff. Those who are 65 and older are also recommended to get the vaccine early if supplies are limited. And other groups that could get vaccinated early next year include essential workers and people who have underlying conditions that put them at greater risk of severe illness from COVID-19, including cancer, kidney disease, heart conditions, and type 2 diabetes. As vaccinations become more widely available, the ACIP will release additional recommendations for distributing vaccines to priority groups. The general population. Vaccines could be available in pharmacies and supermarkets as soon as late February and into March, Azar said Monday. And according to Fauci, adults who don't have underlying health conditions and who are not essential healthcare workers will be able to walk into a CVS or to a Walgreens and get vaccinated with their first shot by April. The COVID vaccines in the works are considered prime boost immunization because they require 2 shots scheduled 28 days apart. While the first injection provides some protection, it peaks 7 to 10 days after the second injection is administered, Fauci said. People will receive a vaccination card that serves as a reminder for when they are due to get the second injection, and includes information about where and when you received the vaccination. If we do that well, by the time we get into the core of the summer and get to the end of the summer and into the start of the third quarter of 2021, we should be in good shape, he said. Fauci has said that 75% to 85% of Americans need to get the vaccine in order to achieve herd immunity. Pregnant women and children. Pregnant women and children were excluded from both Pfizer and Moderna's clinical trials, so it's not clear whether these vaccines are safe for these groups. Moderna's vaccine is still under review by the FDA, but is expected to be ready by late December. Thanks for watching. Don't forget to subscribe and hit the bell button. Like the video in order to receive notification for upcoming videos.